Tap, tap. Tap, tap. Tap, tap. Mark Jabor with Cosmetic Surgery and Laser Center of El Paso. Today I'm going to be performing a rhinoplasty. So you can see this is how the patient presents, and we have a couple main goals that we'd like to accomplish. Number one is to reduce the dorsal hump or on the bridge of the nose so that it's either straight or slightly concave. The second is to address the tip. The tip is drooping, and to address the projection of it. So those two things will be addressed. And the third is to do tip refinement, so to make the tip overall a little bit smaller. So those are kind of the three main goals of this rhinoplasty. I'm going to show you the whole process as we go along. The patient is here asleep, ready to go. So before we prep, I like to inject with the local anesthesia because very importantly, these procedures do tend to bleed a lot, and with the local anesthesia that helps keep down the bleeding and just makes the case overall much more enjoyable. So here goes. So this is my last chance to view it without having any type of local in its natural state. So I've done that. We've talked about the goals. So I'm going to start with some injection, and you don't need a lot, but just that little bit helps out tremendously. So I'm going to go through and I'm going to inject. And you can see it kind of blanching as we do that. That's typical, that's normal. I'm going to inject the nose, and I'm also going to inject the septum, which is on the inside. After that, we'll be ready to prep, and then we will get started. So now the patient's been prepped and draped and ready to go. I've marked out on the columella the incision that I'm going to make. I make an inverted V. Some people make a stair step. It doesn't really matter. You're just breaking up the incision so that the scar becomes much less noticeable, and it usually does over time. So let's go ahead and get started. Let's make this incision. So this is the initial incision. That's why injection of that local anesthesia is so important, because it's a small field, and so you really need to have it dry so you can appreciate the anatomy. Okay, so from here we're going to start elevating. Some surgeons will make this entire incision to begin with. I like to go ahead and start lifting and cut as I see the cartilage, so I can make sure I outline the cartilage perfectly and don't actually damage any of the cartilage as we're elevating the skin. But I'll show you as we get a little further. Okay, so you can see now I'm getting this skin up elevated off the cartilage, which is of course the tip of the nose. And so, like I mentioned, I like to cut as I see. So, you know, this part here can be a little bit tedious, but extremely important because it sets kind of the tone for everything else. So I'm going to continue elevating there, and I'll show you once I get it fully elevated. Okay, so you can see now here I have everything elevated. These C-shaped looking pieces of cartilage are what we call the lower lateral cartilage, and this is what makes up the tip of the nose. So very good exposure here. As we get to here, this comes onto the dorsum of the nose. These cartilage right here are what we call the upper lateral, and then in the middle, coming perpendicular, is the septum. So what I'm going to expose now is that septum, both so I can harvest a piece to use for a graft, and also so that we can perform a push-down technique. So I've been busy, so I've isolated this right here. This is the septum, right? This comes up perpendicular, and so it's hard, you can't see down in there, but I basically have removed the mucosa off of both sides of the septum. Now I can go ahead and remove a strip of it in preparation for the push down. That strip will also be used for a graft, specifically a septal extension graft that I'm going to place, and I will show you both of those things as we get a little further. All of that work, I've removed this strip. You can see here
this point up to here is cartilage, and this point back here is bone, and that's the septum. So that came from right around about like that. That's going to allow for the push down technique. I'm going to use this piece here for grafts. The bone will be discarded, but the next maneuver is going to be to perform an osteotomy or cut in the bone. That's going to go from here on both sides, and then a completion there. And then with the push down, that's going to allow the whole dorsal subunit to be lowered approximately in proportion to the cartilage that I removed there. So I've removed about 4 or 5 millimeters right there, and that's going to allow that to be lowered. If I need to remove more cartilage in the middle to lower it further, I can do that. I don't want to remove too much initially though. So we're performing the osteotomies. So my sensor is going to tap the mallet. This is a controlled cut that's going to be placed on the side of the nasal bone there. Tap, tap. 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 Okay, so that's going to complete this cut right here. I'm going to do the same on the other side, and then I'm going to have to make one more cut in the middle so that I have that whole nasal dorsal subunit mobilized, and I'll show you once we have that completed. So this is the last osteotomy so that we can mobilize everything. So my assistant's going to go ahead and tap, 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 tap. Okay, and I can feel, let me go, let's go one more time, tap, tap there. Okay, so I can feel it's pretty mobilized. Next thing we're going to do is the push down. So we've got everything mobilized. The next thing I do is just come with my thumbs and push down there. And you can see, of course, you know, it bleeds, but you can see almost instantly what that's done to the dorsum of the nose there. That large dorsal hump is essentially gone. Now, from here I can refine it more. If I want to take out more of that septal cartilage, I can. So I'm going to take a good look at things and see if we're really where we want to be, but I think we're very close on the dorsum portion. And when I say the dorsum, just to be sure, what I'm referring to is from here to here, this portion of the nose. Okay, so we're done with the dorsum of the nose. Now I'm going to concentrate more on the tip. So I'm going to take off this small amount of cartilage here. Let's see, relax for just a second on the tip. And you can see that's going to keep a good amount of cartilage for support afterwards. The danger here and the mistake that a lot of rhinoplasty surgeons make, especially early on, is they want to take too much of this cartilage off. And yes, that does help narrow the nose, but then eventually over time with scar contraction and the weight, this will buckle in and it looks like you have a pinched tip, and we don't want that to happen. That doesn't give a natural look. So very conservative on the amount of cartilage that gets removed. So I've got a knife. We're going to go ahead and make that incision. So you can see there. And you got to be careful because on the other side of this is the mucosa, or the inside lining of the nose, and we don't want to remove that. So just the cartilage. So, all right, now that I've got that isolated, I'll come back and I'll take this strip of cartilage out that I'm holding in my forceps right there. Okay, so here's this piece of cartilage. You can relax there. So you can see that we've left a good amount of cartilage for support and strength, and I'm going to do the same thing on the other side. We've done the trim here, what we call the cephalic trim, so that's done. The next thing is putting the septal extension graft. So remember that piece of cartilage that I removed? Well, that's going to go right there. We're going to sew it down, and it's going to actually protrude up farther than what this is. So then this can be a pillar, and I can elevate and suture to this, or I can rotate, or I can do whatever I want. Then when I'm done, I'll just trim off the excess. But because this comes up farther than what the septum does, that's why we call it an extension graft, and that's going to allow me to have full control over the tip of the nose and the location of it. So that's what we're going to do next, is suture that in place, and I'll show you once it's sutured in place and we're ready to suture. These lower lateral cartilages are the tip of the nose to that. We have that septal extension graft on it. It's solid, so this acts as a pillar or a buttress. And now you can see it extends up farther than what the lower lateral cartilages do, or the dome. So now I can use this, and I can deproject, I can project, I can rotate upwards, I can rotate downwards, all based on this pillar now. So I'm going to go ahead and attach this with sutures now in a more projected and a slightly more rotated, so up further position, and you'll see what that'll do to the tip. That plus removing this cartilage here, and it's going to make a significant difference to the tip of the nose. So I went ahead and secured that septal extension graft, and then I put this one more suture here, and this is what we refer to as a lateral curl spanning suture, and that just helps secure and also narrow the tip a bit more. So don't want to overdo that really. It's just to keep the tip from flaring out. So I'm going to have my assistant cut. Okay, so let's go ahead and take this retractor out. And then didn't see me do this throughout the case, but pretty much every maneuver I make, I'll take that retractor out and we'll look and see what has that done to the nose, how has that changed it. Has it changed it in a positive way? Has it changed it in a negative way? If we need to go back and revise that last step, we'll do that. But I think you can appreciate now we're getting very close to the desired outcome that we want. We've lowered the dorsum significantly, we've narrowed the tip, we've elevated the tip, and we've also rotated the tip. I didn't really explain too much why lower the dorsum of the nose the way that I did, because you can just get a rasp and you can shave it down, but I prefer the push down technique because it's a preservation type of technique. It preserves this anatomy right here, so it's not altered, so it's not going to feel rough. It's not going to look open. It's going to look the same. It's just going to be lowered. So in my opinion, after doing noses many years for both ways, I do like this technique better in most situations. So we're getting very close to the end. May put one additional graft, I'll decide. And then after that, we're going to start closing. The thing I did is I put a small cartilage graft right here just to give a tiny bit more projection. I call this a cap graft. And this actually came from, you remember how I removed some of the cartilage right here? Well, I like that graft because it's nice and soft. It's essentially the same material. I've just relocated it. So let's come out with that retractor and redrape. And you can see now, what we have. So I'm very happy with the overall shape, and then also very importantly the support. It's very, very well supported with that septal extension graft. So the last thing I'm going to do is, the patient does have thicker skin, so I'm going to go in there and I'm going to do what we call some defatting, which is just trim. Yeah, you can put that in. Just trim some of the fat there on the undersurface of the flap. So this right here, got to be careful. You can only do so much because you want the skin to be healthy and have good blood supply. So I'm going to do a little bit of that, and then we're going to irrigate and we're going to start closing. What the defatting is, so I just get my scissors and I put it on the undersurface as I'm removing some of that fat. My assistant Marty is suctioning that away. And when you see this whiter portion right there, that's the dermis, so it can't get any deeper than that. So, but it does help with the overall thickness. It's not going to make someone with real thick skin into thin skin, but it does give an overall better appearance when you do the defatting. So this is going to be the last maneuver, and then I'll make sure everything's nice and dry, irrigate, and we'll start closing. Have everything closed now. Remember this initial incision I made and then the incisions there, those are all closed. And you can see what the kind of the final shape of the nose is. And so again, I think I've accomplished everything that we set forth. First thing was to lower the dorsum. That's been significantly done. The second was to elevate and rotate the tip. That has been accomplished. And the third was overall to narrow the tip. You can't really appreciate how much of that has been done because you get a lot of swelling here from this skin, and then especially since I did the defatting. But I've accomplished everything I need to accomplish. The last thing I always look at is, does she need an alar base reduction? I didn't think she did going into it. I don't think she does now. So we're going to put tape and a splint, and the case will be over. Now the next thing is we put tape over to kind of push that skin down as much as possible towards the underlying framework that we worked on. And so I'm going to put that tape on, and then we'll put the moldable splint, and I'll show you the moldable splint. Here's the moldable splint. This is the last portion. Put that on, just kind of hold that in a position, and it dries. As you notice, I put these steri strips underneath the eye too. The reason I do that is it does help out with the bruising. So a little trick I picked up, and it seems to really help out. So once this gets cooled, it dries. And so there we go. We're essentially done. So that's the case. That's the rhinoplasty. I'm Dr. Mark Jabor with Cosmetic Surgery and Laser Center of El Paso. If you like what you see, please give me a thumbs up. If you want to become a subscriber, you can see all the latest content.